Ladies and gentlemen, welcome back to the channel. I'm Dr. Dawson, and today we are going to talk about some dermatology. So dog allergies are extremely common in veterinary medicine. Several surveys have showed that dermatology is probably one of the most common reasons that people bring their dogs into the vet. And often these complaints look something like, my dog is itching a lot, my dog is shaking its head, my dog is keeping me up at night, my cat is shaking its head, my dog just will not stop licking its paws. All of these things are extremely common in veterinary medicine, and especially these days, as in this type of time of year, in the spring and the summer, and going into the fall are the most common times where we see this. And there's a reason for that. Skin diseases in dogs are very common, and there are many different types of skin diseases or ways that we classify them. So there's inflammatory skin conditions, there are neoplastic, meaning cancerous skin conditions, there are infectious skin conditions, and this can include yeast, it can include bacteria, it could even include some specific parasites. It could also include different traumatic types of skin disease, whether it be burns or cuts or scrapes or a whole bunch of other things. And the other thing to remember when we talk about different types of skin conditions is that often they're going to blend together. As in, if your dog has a cut or a scrape or a burn, often they're going to have traumatic and some sort of infectious process going on all at once. Or if they start with an inflammatory process, they're going to eventually lead to some sort of infection often. Or you could have something like a parasitic infection, so like a flea allergy. And that flea is an infectious process, sort of, as well as leading to some sort of inflammatory process. So often they're going to be intertwined, and there's often going to be several different classifications. So of all of these types of skin conditions, probably one of the most common ones that we see individually as kind of the base of these skin problems is allergies, and a specific type of allergy called atopic dermatitis. And this is going to be some sort of allergy to an environmental allergen that is going to cause them to have inflammation in their skin. And often we start to see things like hot spots, we see things like ear infections, being caused by an allergy. So an allergy causes inflammation, which is then going to cause more moisture to be present within the ear or under the skin or on the skin, and this is going to allow for bacteria and or yeast to eventually start infecting that tissue. Now the difficult thing is that to diagnose these allergies, your vet is going to have to rule out quite a few different types of diseases, including infectious as the primary process, because sometimes you can get just a skin infection for no obvious reason, no underlying cause. Sometimes you can get an ear infection just because they went in the lake and it got wet, and then there was enough moisture that they developed an ear infection. The other thing that your vet is going to have to probably rule out for them to diagnose your dog with allergies is an endocrine disorder. So thyroid, Cushing's, diabetes, all of these can cause other skin conditions that predisposes them to developing skin infection. The other thing that your vet is probably going to have to kind of talk about or talk through with you is if it's a food allergy, because food allergies can often look identically to atopic dermatitis. So a food allergy is when they eat something specifically in their food, usually it's some sort of protein like chicken or beef or eggs or milk, so like a whey protein, and often they're going to be allergic to one of these things, and it's going to cause skin symptoms, a lot of times at least. And it's a little bit weird, but it's very common in dogs as well for them to have some sort of food allergy. And so having to choose between is it a food allergy or is it atopic dermatitis may take a little bit of work from you and your vet to identify which one it most likely is. One of the reasons that it's so difficult to diagnose dogs with allergies is that we do see a dermal or a skin reaction to allergies much more commonly than we see some sort of respiratory or puffy eyes like we get with seasonal allergies. So, you know, if you or I get seasonal allergies, often we're going to get stuffy, we're going to have maybe some drainage in our eyes, we're going to maybe have a little bit of a sore throat, those kinds of symptoms, because the allergens are being absorbed across the mucous membranes, and most of the inflammation is going to occur at the point of absorption. However, In dogs, we're finding more and more that most of our allergens, or at least a lot of them, are actually being moved through the dermis or moved through the skin. And this is because of some sort of break in the skin barrier. Now, the skin barrier is made up of the cells and then connections like desmosomes, hemidesmosomes, and a whole bunch of other connections that can be broken down if the skin is not kept in good shape, or if there's some sort of inflammation or infection or trauma. Any of these things can allow allergens to actually cross the skin, especially in canine patients. Some of our allergens are definitely inhaled and they still can cause a dermal reaction, but we're seeing so many of our allergens actually crossing the skin. So a lot of our pollens, a lot of our dusts, a lot of our allergens in dogs are going to cross the skin. And so that makes controlling them a little bit more difficult compared to maybe some of the inhaled allergens. Now, one of the biggest challenges with dermal allergies or atopic dermatitis is the fact that the allergens are going to cause inflammation in the skin. And then when they cause this inflammation in the skin, it's actually going to break down that barrier even more, allowing more allergens to cross that barrier. And this can be extremely challenging to control, and it can also cause the symptoms to just continually ramp up until the allergen is no longer in the environment, which can take quite a while. I do want to make a quick note that this is not a comprehensive review of all things allergies. It's extremely complex, and I just don't think you guys care about the nitty-gritty as long as you know the basics and enough to understand why we recommend doing the things we recommend as veterinarians. So how do we stop this positive feedback loop causing more and more inflammation, causing more and more absorption of allergies, causing more inflammation, and actually allow the skin to heal properly so that they're not having this constant reaction? Well, the first step is usually to treat any sort of infection. So if your dog has an ear infection or if your dog has some sort of skin infection, treating that first is going to be number one. So getting rid of that infection is going to allow that skin to start healing. The next thing that we're going to want to do is decrease the amount of inflammation. And that inflammation can be taken down in several different ways, but primarily we're going to be looking at using some sort of anti-inflammatory. Sometimes we try antihistamines, but it is limited success in dogs, so things like Benadryl or Zyrtec or all of those antihistamines, they just don't work as well in dogs as they do in people. So if that's not working, often we're going to jump to some sort of anti-inflammatory like Apoquel or some sort of anti-itch like Cytopoint or something like prednisone, so a steroid. Now, I don't like to go to a steroid just because of the side effects, and in my next video we'll actually talk about the pros and cons of each of these again. I know I have some old videos about it, but we'll go over it yet again. But one of these anti-inflammatories is going to be imperative for us to be able to start controlling that inflammation and allowing that skin to start healing. Now, the next step is going to be some sort of topical method of helping to keep that skin integrity and basically try to topically help manage the amount of skin that's allowing allergens to cross the barrier. And the other thing that we want to do is try to topically remove as many allergens as we can. So if your dog is very, very allergic when it goes outside in the grass, then making sure that you wash their feet when they come back in the house, wiping them down, wiping between their toes where a lot of times those are going to absorb, wiping out their ears are going to be very important things in helping to decrease the amount of inflammation and amount of allergens that they're exposed to. Some dogs can be managed pretty well with frequent bathing, so once every couple of weeks. You want to make sure that you're not going too often though, because if you go more often, you're actually going to dry out the skin most of the times, and this is going to decrease skin integrity. So although we're removing allergens, we're going to make the skin more susceptible to allergens crossing, which isn't a good thing. The other thing is going to be choosing your shampoo very carefully. So I'd recommend either some sort of hypoallergenic shampoo or a shampoo called Duoxo. And they make a couple different types, but the things that I like about this are, one, it leaves a chlorhexidine residue behind. And this is going to prevent or decrease the amount of infection that can cross the skin because it's going to help control bacteria and yeast. And although this probably doesn't last very long, it does often last a couple of days, decreasing your risk of a hot spot right after a bath. Now, the other thing that it has is something called lip acid, which I'm not going to get into the details, but it basically helps to increase the amount of moisture in the skin after a bath. And the other thing that it has in it is something called phytosphingosine, which basically is another product that has been used to decrease itching and inflammation in dogs, and has been shown to work very well. So what is the summary of this video? What do I want you to take away from all of this information? What do I want you to know about why your dog is itching? It may or may not be allergies. So first of all, if your vet wants to rule other things out, don't begrudge them that. Let them try to rule those other things out, because if they miss something like thyroid disease or Cushing's or a primary infection, you could be spending a lot of money on allergies without seeing much of a benefit. If your dog has been fully diagnosed with allergies or some sort of atopic dermatitis, don't expect to cure them. It probably won't. But we're going to try to manage it best we can and decrease the amount of itching, scratching, and self-trauma that they're going to do to themselves. So the other thing that I really wanted to mention is that allergies are not just a medication fix. You guys can't just expect medications to do all of the work for you. Allergies are something we're going to manage, and medications are one of those tools. But one of the other things in that toolbox is going to be things like washing your dog's feet, giving them a bath. Other things are going to be decreasing their exposure to allergies. So, if it's a really bad time of the year, keeping them indoors more, or keeping them on paved surfaces, or keeping them where they're not going to be nearly as exposed are going to be just as helpful as the medications. So the medications are going to help, and they're going to relieve that itch. They're going to make your dog feel better, but they're not going to magically cure them. So we need to do multiple things, and a lot of that is going to be on you guys as pet owners at home to managing that appropriately. Now, the other thing that I really want to quickly mention is that these medications, especially if your vet wants to use Apoquel or Cytopoint, they're both pretty expensive at this point. So for example, my dog, as a veterinarian, with very little, like the practice that I work for doesn't take any money off of this. It costs me almost $90 to give Watson an injection every 6 to 8 weeks. So it's very expensive. I don't know another way to say it. It just can be expensive and it can add up. So a lot of people who are on a budget end up going with something cheaper like prednisone. But this has its own side effects, and I really don't recommend it for most people unless there's not a better alternative or if it's outside your price point. But it also is something where, especially at the beginning of managing allergies and at the bad times of the year for atopic dermatitis, using some sort of anti-inflammatory is extremely important. And if your vet recommends it, they probably recommend it for a reason, and it's not just to make money. I'm not making any money off of this video. If you go get Cytopoint Apoquel, I make nothing. This isn't sponsored, so the reason I'm telling you to use it is because I've seen it work so many times. And you should really talk to your vet about what's going to be the best option for you. My next video, we're going to talk about the specific medications of Cytopoint, Apoquel, prednisone, and I may even mention a couple of others that have been used for allergies in the past. The advantages to each, the disadvantages to each, how you and your vet can make the best decision for your pet. So if you guys are interested in seeing that video and you're not subscribed already, make sure you subscribe and hit the notification bell, because then you'll be notified when that video goes live. It will probably be next Tuesday if everything goes well over the weekend. So have a fantastic rest of your day, guys, and we'll see you in the next video.